All right. Hey, it's Dr. Brett here at Delta Health, and we're going to introduce you to our newest provider here. It's Dr. Rachel Wanninger. She has joined us as a functional medicine doc, and it's kind of an interesting story how she got into it. So I want to just have Dr. Rachel give us an idea of like what led you down this path to begin with.
Mm-hmm. So, end of high school, beginning of college, I was struggling with some pretty bad fatigue issues. I was a soccer player at Drake, so about 1 minute into every single game, I felt like I had played 90 minutes and I couldn't run anymore. It was a horrible feeling. Saw probably 5 different doctors. Nobody really had answers. Tried a bunch of different medications, made things worse. And then through my own family's health journeys, and then through my own, we kind of stumbled on the functional medicine route. Immediately had answers, had a path towards healing myself, and within the following season, I was kind of back to normal, and I stepped actually out of bounds after subbing out one time and was in tears because I could run again, and it was pretty amazing. Yeah.
So a real life experience with it.
Yeah.
That obviously there's some emotion that goes with it as well too.
Yeah.
That defines that. I think a lot of people have a question like, what are some common conditions that people see a functional medicine doc for?
Yeah. So it's a lot. There's all across the board. I'll give a few examples. One of the big ones that people hear about a lot and something that is common would be gut issues. So someone can come in with different symptoms of bloating, stomach pain, loose stools, constipation, all the above.
Yep.
And we kind of figure out what's going on at the root cause. So it could be a food sensitivity issue. It could be a leaky gut issue, which the world will hear more about. But could be a celiac issue, could be a lack of proper digestion, could be all the above. And we can run tests, figure out what's going on there. So that's one example. Another one would be just general like fatigue or fibromyalgia, those kinds of chronic fatigue, adrenal fatigue issues. People don't really have a why of why that's going on. They don't have those answers. And so could be any different things. Could be a thyroid issue, could be adrenal burnout, different things like that.
Gotcha.
So,
what about like sleep things? Is that something you guys see?
Sleeps a lot. That gets down to the adrenals, cortisol issues, all kinds of different stuff like that.
Yep. I mean,
hormone imbalances, anxiety, depression.
Okay.
Yeah.
It's pretty wide spectrum.
It's pretty wide spectrum. Yeah.
What about like adults and kids, even like age range? Like, do you see different things within there?
0 to the end. Yeah.
Okay.
Yep.
Cool. Well, another thing that I know I have questions on, and a lot of people do as well too, is like the difference between kind of a functional medicine approach versus a traditional medicine approach to stuff. Because a lot of people have gone down the same path with the same results, with the same people, with the same pills, and they're just finally to a point of like, okay, what else do I try? And they just don't maybe know the difference. Yeah.
And so I know exactly how that feels. I know, I went through it. But the difference with functional medicine would be that we really aim to find the root cause of what's going on. Why is somebody showing a disease? Why does somebody have certain symptoms that they can't even name as a disease? Things like that. So they really look to go to the root cause from the ground up, what's going on.
Gotcha. So addressing the cause of the problem and not just the symptom.
Yeah, rather than masking symptoms, why is it happening?
Okay.
Because the body's smart, the body's wonderful. Things go wrong for a reason. It just doesn't go wrong because it goes wrong. There's a reason behind it all. And it seems simple, and it is simple, but it's complex because it is the body. So there's always a reason why.
If you give it what it needs, it will do what it's supposed to do. Type of deal.
Yeah.
Nope, that makes a lot of sense. So I guess kind of final question with this, like how does someone kind of get started with functional medicine? Like if you're like, I've never done this before, or I've been doing traditional medicine for a long time, I want to see if this is something that works for me. How do they start?
Yeah. So a lot of times people have never heard of it, which is fine. And then there's a lot of times where people have heard of it, but they've heard snippets of it, or they've heard different routes that the natural world can take. But I'm going to offer a kind of a free 15-20 minute consultation for people to get to know me, for me to get to know them and a little bit of their story, to decide what route we can take, if it's the right route, because there are changes involved when it comes to lifestyle and diet and making changes to better yourself and get towards, the optimal wellness side. And so it's just kind of a way to get to know each other, and then if that's the right route and if it'll work for them. Yeah.
Perfect. Awesome. Well, we appreciate your time with this. We look forward to seeing a lot of people with some really cool stories come out of this as well too.
Me too.
Hopefully you guys kind of heard that as well too. Like what we're going to offer in the beginning is consultations with her. And if you've got questions on how this apply to me, or you're just like this, I know this is a route I need to go, take advantage of it. She has a ton of knowledge. She's very passionate with what she does with it. And no matter what the outcome from that consultation is, you'll feel better about doing it at that point. So stay tuned for more of that. And we look forward to seeing you soon. Thanks.
Thanks.